For your health tonight, something startling happening to middle-aged white Americans. A study released by two Princeton economists found the death rates for this group are not being driven by big killers like heart disease, but by an epidemic of suicides and afflictions stemming from substance abuse, including alcohol and overdoses of heroin and prescription drugs.
So joining us to talk more about this alarming trend is Kimball Richardson, a licensed mental health counselor at the Community Health Network. And Kimball, we're glad you're here. So are you surprised by this information about more prescription painkillers being a reason for suicides?
I'm not surprised. I'm troubled, of course, by the sheer number and amount of folks that are taking their own life.
You know, don't we know enough about depression? Why are people not recognizing this?
Look at the demographic. We're talking about males. It's still true that it's tougher for guys to ask for help and to recognize what might be symptoms of depression. Because sometimes in men, it's maybe not so much sadness as it is irritation and anger. Not always the case, but sometimes. And when that happens, it's hard to know. I need to get help for it.
Well, one of the things that's surprising is just the sheer numbers that we're talking about here. What's driving this trend? We talked about alcohol abuse, we're talking about substance abuse,
right.
But it really is things of that nature, correct?
Well, and untreated depression, of course. We do think that there are some issues with financial matters that go into play, of course, relationship issues and all of those things. People's overall health can make a difference too.
What can we do about this? I mean, you feel so helpless if you have a relative who's depressed or out of it. You know, what can we do?
We suggest that people approach their friends and loved ones directly and say, I'm worried about you. Here's what I'm noticing. I'd love for you to get help. And here are some ways that you can get help. You know, one thing that we're doing at Community Health Network is we were recently awarded a grant to help people in this age group. One of the things we're doing, I think that's a little unusual, is we are targeting working with our gun shops and our firing ranges to educate their staff and their owners about signs of suicide.
All right, Kimball, thank you very much for joining us. We
You're
appreciate
welcome.
your insight.